Well, good afternoon. Hey, I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic, and we're at our third part in our series about heartworms. And this portion, I wanted to talk about heartworm treatment. We talked about the life cycle of the heartworm. We talked about prevention. Of course, prevention is the best way, and we prefer to do that rather than have to treat them, but we do have effective treatment for heartworms. We talked about there being some resistances to heartworm prevention, and so treatment may become more of a factor in the future. Just like with a lot of diseases, early detection is important because the longer heartworms are present inside the heart of a dog, the more damage they do. So if we can diagnose them quickly, early, and get them treated before they do damage, then the dog can live out a normal life and survive treatment and do very well. The heartworms do cause damage in the heart over time. As we mentioned, the heartworms live in the right side of the heart, and they're showering the pulmonary circulation with waste products from the heartworms. It's gross. It's like they're peeing and pooping in the right side of the heart, and it's going to their lungs, to the dog's lungs. So we don't want that. So treatment is a 4-month process, and that sounds arduous, and most of that is part of the waiting process. To begin with, you do your minimum database to check the dog's health to make sure they can handle the treatment well, because the treatment is difficult and it can be taxing on their body, and so you want to check the lungs and make sure what kind of damage has been done, if any, from the heartworms. You want to make sure you check the kidney function, liver function, that they can handle metabolizing the medication that we'll be giving for the heartworms, and just generally checking their health. And that's the first part of treatment. And the second part is we put them on doxycycline for a month. And I won't get into all of it, but doxycycline actually kills off a parasite that protects the heartworms and makes the heartworms easier to kill. So we kill off that parasite called Wolbachia, and we do that with the doxycycline for a month, and that's pretty easy to do. It's an antibiotic that you give once a day, and then they come back in after a month. We do the first phase of the treatment. It's an injection, and it's actually a form of arsenic that's been refined, and because the arsenic will kill off the heartworms, and it's basically a dose that's high enough to kill the heartworms, but it doesn't kill the dog. That sounds horrible, but that's basically the way it is. That's the way a lot of parasiticides used to be. That's the way chemotherapy used to be, but it's become refined. And this one is refined. It's not near as taxing on the system as the heartworm treatment used to be. So we give them that first phase of treatment, and then it's very important after that the dogs stay pretty confined, pretty calm, because you're killing those heartworms off slowly. And what happens, just like we said, they're living in the right side of the heart. Well, if you're giving a medication to kill them, they're dying. And when they die, they slowly deteriorate, and pieces of the heartworms can sort of break off into the circulation and go into the lungs. And if they break off in large chunks, so to speak, it can cause pretty severe damage. And so our goal is that they would dissolve in tiny little particles, float off into the circulation, and the body's immune system picks that up and takes care of it. But if they're too active and the heart's beating real hard, then those heartworms can break off into chunks, and then you get the significant issues. And so that's why the dogs are supposed to be confined and calm during the follow-up after the treatment. We see them after another month, and they have the second phase of the treatment, which is 2 injections of the milbemycin, the treatment that we get. I'm sorry, imidacide. Misspoke. Milbemycin is not, that's a prevention, but imidacide. And we give that 2 injections of that, and then they go home again for another 30 days, and then we follow up later with a test to see if we have killed off all the heartworms. And almost always the test comes back negative. We're clear, but there are rare cases, probably about 2% of the cases, where you have to go back and you have to do an additional treatment to kill off any remaining heartworms. And after that, if the dog's come through, hasn't had any side effects, hasn't had any damage to the pulmonary circulation, then they go on and usually live out a normal life. Some dogs can have some scar tissue from the damage in the lungs, and later on in life may have some fibrosis and some coughing and things like that. But they usually do really well. And so that's sort of what treatment looks like for heartworms. So thank you for listening. That's the end of our 3-part series regarding heartworms. But please, this is not the end of the information that you can get. Call us anytime, come by, and we will be glad to discuss heartworm life cycle, heartworm prevention, heartworm treatment, anything about heartworms that you would like to talk about. Thanks for listening.